following is a production of West Virginia Public Broadcasting.
Major funding for Doctors on Call is provided by a grant from the Milan Charitable Foundation. Other funding is provided by the Health Plan, a health maintenance organization serving West Virginia and Ohio since 1979. By the Center for Organ Recovery and Education, supporting Volunteers for Life through organ, tissue, and corneal donation. By Health South Rehabilitation Hospital, serving your rehabilitation needs in Morgantown and Fairmont. And by the faculty and staff of the Robert C. Byrd Health Sciences Center of West Virginia University.
Welcome to Doctors on Call. Tonight's topic, good health after 60. Two experts are here to answer your questions. Now here's your host, Dr. John Phillips.
Good evening. Time flies. Baby boomers who spent the 1960s coming of age with the Beatles, Vietnam, and Woodstock are turning 60, hoping to become the healthiest, most active senior citizens ever. But the generation that promoted free love is now using Viagra. They started the jogging and aerobic craze, but now they're getting knee replacements and tummy tucks. So just how healthy are they? What are their most serious health concerns? What can they do now to ensure good health into their 80s and perhaps beyond? We'll get answers to those questions and more tonight from our two guests, Dr. Rick Lane, an internal medicine physician and geriatric specialist at West Virginia University, and Dr. Bill Shocker, who's also an internal medicine physician at WVU. If you'd like to ask our guests a question, give us a call. Our phone lines are now open. Rick, thank you both for being here. We'll start with you, Rick. So, Rick, are baby boomers healthier than the generations before?
Yeah, they are. They're healthier in terms of reduced rates of certain diseases, especially cardiovascular disease, and also in terms of increased functional ability, able to do more or less deficits in ability to do essential items of daily living, and much more functionally fit than past generations. And they're also living longer.
Well, I guess to figure out why that's happening, we need to understand what happens to the body as we age. So,
some of it's fairly straightforward stuff that everyone would expect. Wear and tear, wearing out, cartilages getting thinner, joints getting worn out, bones getting thinner. That's part of it. Part of it actually continues to improve. There's data now about brain growth all through life. That's a huge change from 15 years ago even. Mm-hmm. So most of it wear and tear, most of it getting better, we don't know, but both happen.
And what are we talking about as with regard to life expectancy these days?
Well, life expectancy has increased, of course, dramatically. Around 1900, for example, life expectancy was about 45 years. So if you were born in 1900, on average, you might expect to live about 45 years. Now you may expect to live about 80 years. So it's practically doubled in that time span, which is tremendous. Looking forward a little bit, there is the expectation that the life expectancy will keep increasing, but very slowly. We won't have the kind of gains we had for the last 110 years.
And there is a difference between men and women?
Yeah, there is a difference. Some difference we're very sure about, but the difference in terms of living longer, one of the major theories is it has something to do with the hormone estrogen that, of course, women naturally produce in greater amounts than men. Men produce some too, but not as much as women.
Okay. Well, what sorts of things can elderly folks do with regard to routine care to stay healthy as they move into their older years?
Some of it's the same as being a younger adult, having an established physician. Dr. Lane's my physician, and going for regular visits. Part of it now is becoming educated. You can learn about diet, exercise, medication effects, attitude, and emotional state online. Mm-hmm. That's something that was not there 20 years ago.
Why don't we summarize some of the routine care that elderly folks should receive, men and women? So, for example, for prostate issues.
There's data that checking your prostate every year for a man is of benefit, that you'll live longer and perhaps better. There's some data that the blood test is of benefit. There's some data that we don't know what to do with the blood test, and that's where a patient should talk with a doctor, and we're back to that relationship. Okay. But there's even data now about cholesterol after age 65, and treating cholesterol, reducing heart attack and stroke. And stroke's a big concern in the elder population.
We were talking earlier, and you were saying that stroke is actually maybe a bigger concern than death itself.
Yeah, I think several surveys have shown that older people are more concerned about a disabling stroke than they are about dying. They would rather die than have a disabling stroke, so it's a big problem. Thank goodness that the cardiovascular events are reducing. The rates of those events are reducing, so heart attack and stroke, we're seeing some reduction. And it's probably an effect of the long-term efforts on hypertension. So that's one of the things, that a routine visit with a physician that older people should also be doing, blood pressure check, and that should be probably every 1 to 2 years. We're talking about people who are perfectly healthy and don't need to see a physician for ongoing care of medical problems. Other things would be a periodic hearing check, periodic eye check.
Vision check.
Yeah.
And some things that we don't normally think of, just listening, having your doctor listen to your belly, just hear if there's any abnormal vessel flow, to be a clue to look for something that can be fixed now before it presents with a symptom or a problem.
Yeah, screening for men who are between 65 and 75 and ever smoked for abdominal aortic aneurysm is now recommended.
At
I didn't
65?
say that very well, but well, if you're 65, but if you've been missed and you're now 70, but you're a man, never been screened for a AAA abdominal aortic aneurysm, you should have that done.
And is that screening an actual image study or just a physical exam?
Yeah, actually, that's a very good point. The screening that's recommended is by ultrasonography, so using the sound waves to bounce off the abdomen. People may know of that, sort of like a B scan that women get for pregnancy, but just that, an ultrasound exam, a one-time ultrasound exam.
Okay, very good. Well, we already have our first caller, Donna from Wyoming County. Donna, welcome to Doctors on Call. What's your question?
I went through the change of life at 50, and I'm 57 now, getting ready to turn 58 in September, and I bled for 2 days. Is that normal, or should I be worried?
Are you on any hormone replacement therapy? Estrogen,
No.
progesterone?
No, sir.
Bleeding after having stopped and having gone through the menopause years before, that should be evaluated by a physician. You should see your doctor and have that evaluated. Problems can range from hormonal problems to more local problems causing the bleeding. So that certainly merits evaluation.
Okay, very good. Well, we talked a little bit about screening. What about exercise? Is there any difference for elderly with regard to what they can do with exercise?
There's the added factor, what I'll call disease burden or illness burden, in that if you have atherosclerosis, coronary disease, starting up exercise or being too vigorous with it may unmask it and give you trouble. So wise advice to older patients is to see your doctor, have an examination, talk about what exercise you're planning. But yes, exercise, aerobic exercise, walking, balance exercise, Tai Chi, dance, stretching exercises, yoga. They all have benefit, immediate in terms of well-being and health, feeling and mood and emotional state, but also in terms of functional independence and functional ability that Dr. Lane was referring to earlier. So yes, there is benefit.
Yeah, one of the bits of
But
advice.
seeing your doctor is good advice before you engage or start.
Right. One of the bits of advice is, with a lot of things, start low
And go slow.
slow, increase, but do it. Yes.
Yeah.
What about diet?
Diet should be a well-rounded diet. We want to avoid excess salt, excess simple sugars, and especially for women over 65, calcium supplementation. And another thing that is becoming more and more of an issue is the idea that perhaps we need to be on a bit more vitamin D than previously thought. And from an accumulation of a lot of different studies, I think there's a fair consensus now that vitamin D at 1,000 units daily is a good idea.
For men and women.
Yes.
The purpose being, what does vitamin D do for us?
Well, most people think about vitamin D as being healthy for bones, which it is, but it has been learned there's a lot of different effects of vitamin D, and there is some effect on muscle, And this is again important with exercise, and there's probably effect on some other systems that have something to do with our rates of developing cancer, for example. So it's a complex hormone. And we often have been taught that if you're out in the sun a lot, you get enough vitamin D because your body is making it, your skin makes it. Well, your skin makes some, but it turns out even people who get a lot of sun exposure sometimes are deficient in D.
Very interesting. Well, we have our next caller. We have Sharon from Mercer County. Sharon, welcome to Doctors on Call.
Thank you very much. My question has to do with fibromyalgia. I've been diagnosed by 3 different rheumatologists. The only known treatment, from what I understand, is Lyrica. That doesn't work for me. Is there any other treatment available? And the second part to my question is, friends and family really don't seem to get that fibromyalgia is like an octopus with many different tentacles of symptoms. And how do you get through to them this is very real?
Why don't we start by having one of you let the audience know what is fibromyalgia?
You do that, I'll do the answer on treatments. Or vice versa?
Fibromyalgia is a syndrome of aching, which is the algia part of fibromyalgia, in various parts of the body, in the soft tissues, basically. So it is not so much in the joints, which we think of as arthritis, as in the soft tissues of the body. It has been described for a very long time. There have been lots of articles about fibromyalgia, and it has been fairly well described in terms of what points in the body should be tender to make a diagnosis of fibromyalgia. We don't know what causes it at all. And
is it an illness of older people, or can happen at any age?
It can happen at any age. And
Adults, I don't know that it's a pediatric illness.
Yeah.
But there are treatments beyond the Lyrica, too. There are other medications that used to be used for depression that have some benefit, and they're the newer medications for depression that have some benefit in it, the SSRI drugs, they're called. Massage, yoga, stretching exercises, some aerobic exercises. There's such a tie-in between mood and the physical discomfort of fibromyalgia that a lot of times when the mood is getting fixed, the other physical symptoms improve.
Okay.
If both improve, that's a good thing. And it is a difficult illness. There's not a lot of, or not complete belief in it as a serious illness. People don't understand because you look healthy, but you have pain and discomfort and dysfunction. And it's hard to prove to a person who needs a test result that would show the diagnosis.
Yeah, there's no
test result.
Mm-hmm.
And then to answer Sharon's second question, does it run in families?
Not to my knowledge.
Not that I know either.
Okay. Okay, very good. Well, Bill from Raleigh County is now on the line. Bill, welcome to Doctors on Call.
Hello.
Hi, Bill.
This is Bill.
Nice to hear from you. Welcome to Doctors on Call. Do you have a question?
My question is, I'm an 83-year-old male and in pretty fair health, but I am a solid bluish black from my knuckles to my elbows on both arms.
Oh, and Bill, have you had any injuries lately, or it just
No. It's gradually turned, and it's not. It's just on the backs. It's not on the lower side.
Are
But
you on aspirin?
it's been that way for several years, and I just wonder if it's some of my medication. I'm on Plavix.
Is
Would that
aspirin
do
one
it?
of your medicines? Is aspirin also a medicine with the Plavix?
Yeah.
Both of those do work by thinning the blood, maybe be a good phrase for it, by interfering with one of the clotting mechanisms our blood has. And the least bit of disruption or bump or stretch on fragile, thin skin can leave bruises and bluish, purplish discoloration. And sometimes a doctor will tell a patient to either cut back on the dose of either of those two medicines or cut back on one of them. It'd be worth going to your doctor and discussing that very issue.
And we do see this fairly commonly at that location he described, and it's there and not there or here because there has gotten a lot of sun over the years. So it's so-called actinic ecchymosis, sun-induced bruising. So this is why, and I think Bill's point's very good about any added tendency to bleed into the skin, which is what a bruise is, will make that even worse. So aspirin, the medications like Plavix, warfarin, we'll see that sometimes also.
Very good. Well, I hope that helps Bill out. We have Pat now on the line from Mercer County. Good evening, Pat. How are you?
Fine, thank you.
You have a question?
Yes, sir. My mother is 86 years old. In October, she had a portion of the colon removed from complications of diverticulosis. In January and February, she had to have some pockets removed, and then the stomach cavity filled up with air. Since then, her stomach continues to be extremely enlarged, and she has very little energy. Do we need to go back and look at this problem again, maybe?
Yeah, that raises a number of issues there, and of course, part of our approach to that general problem would be be a lot of history we would want to know, her other medical problems, the medications she is on, and then I suspect a fairly comprehensive evaluation would ensue to look at a wide range of things, ranging from anemia, hypothyroidism, to problems in the belly itself. Could be one thing that's causing her problem, could be more than one thing.
Several minor things adding up to a major symptom, and being tired would be a symptom for any of the conditions that would leave your belly, overly full of air or distended. That'd be worth going back to the doctor and pursuing.
Mm-hmm. Well, good luck with that, Pat. We now have Eva from Belmont County, Ohio. Eva, welcome to Doctors on Call.
Thank you. I was in the hospital for 12 days. I had gastric paresis, and I'm just afraid that it's going to come back. Is there anything that I can do to prevent it coming back?
Let's start with explaining what gastroparesis is.
Before I explain it, can I ask quickly?
Sure.
If it's not too much information to share, do you have diabetes by any chance?
No.
Because that's one of the common conditions that's associated with gastroparesis. Gastroparesis is the stomach, the stomach mixes food and then moves it on into the bowel. And gastroparesis, paralysis, is it just doesn't work well. Slows down, sometimes for 2 hours. And it's tested by eating a meal of egg or solid food and watching how long it takes to come out of the stomach. And it can happen to anybody short-term with another illness. And that's the short-lived, it'll be better. We get some gastroparesis if we get a viral bug, part of the throwing up. But it can happen long-term with illnesses like diabetes and some very rare things that could be behind it. So if someone has it for a long enough time without one of those explanatory mild short-term illnesses, then it is worth looking into further. Mm-hmm. So it could come back.
Okay. Very good. Our next caller is Debbie from Monongalia County. Debbie, good evening.
Good evening.
You have a question?
Yes, I have hypo with my thyroid, and the doctor put me on 150 mcgs, and now she put it down to 125, but I have this pain all over my body and in my muscles, and I just wondered, is that normal, or will it ever go away?
So hypothyroidism, she's talking about low functioning of the thyroid gland, which is usually diagnosed with a blood test. It's fairly common. It's so common that people talk about routinely screening for it in older women, especially because it is so common. So she's talking about that hypothyroid condition with being treated with thyroid hormone replacement therapy. And it is a fairly simple thing in medicine. One of the few things that's fairly straightforward. You estimate a dose, you try the dose of the thyroid hormone, and you check a thyroid blood test. And the blood tests are fairly accurate and can guide you to increase or decrease. And I believe she said her doctor decreased her from 150 to 125. Yeah. Then it merits another check at some point in the near future, near probably being a month, 2 months.
And the pain she was talking about is part of the symptoms?
There are people who feel difference in their body with small dosage changes, discomforts, tiredness, pain, and it could be part of that.
Yeah, we never say never.
Sure. Well, we have some excellent calls tonight, and we have another caller, Richard from Westmoreland County. Richard, good evening.
Hello.
How are you?
Fine, thank you.
Great. Do you have a question?
Yes, I have three actually.
Okay.
I heard on the radio, I believe, that you shouldn't take vitamin E if you smoke. That's one. Two, what's the optimal level of CoQ10 that you take? And I'm about ready to have my yearly physical. And tell me what test, if I'm concerned about, I'm worried about friends of mine have gotten cancer recently. What test do I tell the doctor to take?
How old are you, Richard?
69.
69.
Okay.
Okay, so vitamin E and smoking.
Yeah, we were talking a little bit before about nutrition, and patients commonly ask me what should they take, and vitamins and fish oil and CoQ10, coenzyme Q10, and this sort of thing. And unfortunately, what we know is good for you in terms of supplements is very short list, very short list. We used to routinely recommend a multiple vitamin for older people. Now the experts say we don't know that they need that. The vitamin D, vitamin D as in dog, we talked about before. There is not good evidence for routine supplementation with either vitamin E or coenzyme Q that I'm aware of as a routine supplement. And we're always concerned, if we don't know it helps, it's always possible it could hurt. So I would recommend against it.
And that's one of the ones that too much of a dosage, vitamin E, as in Eddie, too much might hurt heart, might increase heart failure. As they're trying to learn this, that might be a harm. So don't go above 400 international units for that.
Before we get to the second question, one thing we do know for sure and have plenty of research is that smoking is not good.
Right.
So maybe,
at any age.
Right, don't worry about the vitamin E so much as to
Stopping smoking.
And then the second question?
The part about tests. There are tests that have been looked at over decades that help all adults, and they still continue to help. And one of the reasons we think they help is because they might be a clue for cancer, amongst other illnesses. So a blood count for anemia, the thyroid test. But PSA is an important test for men, and some patients and their doctors, when they discuss it, want to get a PSA, and some do not. So that's a dialogue to have with your doctor about testing.
Colonoscopy.
Colonoscopy after age 50, and is it every 7 years, every 10 years? There's an interval there when they're normal, but get the first one, and if he hasn't had one in 7 to 10 years, it's time for a second one. Probably not chest x-ray. It just does not catch a meaningful cancer at an early enough time to make a difference.
Okay. So a long discussion with this physician is really what it means.
Yes.
And of course, there's a few immunizations that he should be sure that he's had. Pneumococcal, which is a pneumonia vaccine, he should have that. Influenza in the fall, of course. There's a shingles vaccine that's worth a discussion with his doctor. It's a little pricey, the way it's been put on the market and the way Medicare handles it. It's more like a prescription drug rather than a vaccine, so you have to get a prescription for it and go pay for it, or your insurance company has to pay for it. But it's worth a discussion. In some studies, it did reduce the rate of getting zoster, which is shingles, people often know.
Okay, well, we only have 2 minutes. We're going to try really quick to fit Helen in from Preston County. Helen, do you have a question?
Yes, I do. I've been diagnosed with low vitamin D, and I took mega doses of vitamin D last fall. It was 50,000 international units for 12 weeks, and it raised it up about 3 points. And I'm continuing to take 2,000 units per day now with a multivitamin. And I would like to hear some comments about what the normal level is expected to be. And I've also been told that the symptoms of low vitamin D is like fibromyalgia, and I'd like to hear about symptoms.
And do you know your level at the most recent check?
Most recent check was 18.
Okay. Well, of course, this depends on the lab that your doctor is having you use. The lab can set its own assays, has its own assays, and sets its levels by that. I can say in our lab, the assay is above 30 is normal. Between 15 and 30 is insufficiency, and below 15 is a deficiency. So it depends on what the lab you're using is using as those levels. But it sounds like it was a good thing, and I think the aches she was having, I hope they are improved with the vitamin D. I think it could have been related. People certainly do get some problems.
Well, we've had a wonderful discussion. Thank you both for being here. Thank all the callers for calling in. We've been talking about good health after 60 with Dr. Rick Lane and Dr. Bill Shocker. Thank you both for being with us. If you'd like more information, see your family doctor or visit our website at wvuhealth.com. For Doctors on Call, I'm Dr. John Phillips. Good night and good health.
Join us again next week for another edition of Doctors on Call. Our topic will be summer emergencies.
Major funding for Doctors on Call is provided by a grant from the Milan Charitable Foundation. Other funding is provided by the Health Plan, a health maintenance organization serving West Virginia and Ohio since 1979. By the Center for Organ Recovery and Education, supporting Volunteers for Life through organ, tissue, and corneal donation. By Health South Rehabilitation Hospital, serving your rehabilitation needs in Morgantown and Fairmont. And by the faculty and staff of the Robert C. Byrd Health Sciences Center of West Virginia University.
This has been a production of West Virginia Public Broadcasting.